Welcome to HRAs from Confusion to Control. Actually, we're going to give you just a couple of minutes to log in, get settled in, and make sure that you're ready for some fun HRA stuff. Take a minute, if you would, just to familiarize yourself with the module here on the screen. You can, you should be able to see the presenters, and you should be able to see the slides. There's a chat, and I'll tell you all about what else we have for you in less than a minute. So get ready. Okay. It's 12:01. That means it's time to start. We want to be respectful of your time. So first, I wanted to, again, welcome you to our webinar entitled HRAs from Confusion to Control, How to Harness HRA Flexibility to Serve Your Clients Better. My name is Becky Crutchfield. I am the Director of Partner Growth and Business Development over at Clarity Benefit Solutions, and I am here with my VP, Eddie Larned, and I'll let him introduce himself.
Thanks, Becky, and good afternoon or good morning, everyone. My name is Eddie Larned. I am Vice President of Sales with Clarity Benefit Solutions, and really looking forward to this 1-hour continuing education course that I will be assisting Becky with, providing some commentary and going through some poll questions with you. So thank you all for attending. Really looking forward to spending this next hour with you covering health reimbursement arrangements.
Okay, so here's what we're going to do. We're going to cover first an overview of HRAs, what this employee benefit is all about. We're going to take a look at how HRAs are being used today. Then we'll examine the case for offering HRAs from various stakeholders' points of view. Then we'll outline the 2 basic types of HRA. We'll drill down into the most prevalent plan design options that are customizable to clients' needs. We'll discuss how HRAs work with other employee benefits like HSAs and FSAs. We'll give some thoughts on what brokers and employers should look for in an HRA partner. And finally, time permitting, we'll answer just a few questions. So hold on to your hats. First things first, housekeeping rules. Just be aware that with this platform, the On24 platform, it actually knows how long you're on the call. And since this is a 1-hour CE, we need you to be on the call for the entire time. We'll try to entertain you as best as we can. Throughout the presentation, we're going to provide poll questions that you can respond to. These are going to be directly in the slide view, and you should be able to answer right there in on your screen. Also, in the background, we have a whole team of people that are ready to help. If you have any technical questions, just put any of those in the chat, and our team in the background will see and be able to answer. Also, if you have any questions for me or Eddie, be sure and put those in the chat, and those are the ones that we're going to get to as if we can, get through all the slides and have some time in the end. We will make sure that you get your certificate within a few days after finishing. And we're also going to send you a link of the recording so that you can watch this over and over again. So we're excited to spend this hour with you. Thanks for spending time with us. Let's get started. You ready, Eddie?
Ready, let's go.
Okay, we're going to start with an overview of this important employee benefit. Health Reimbursement Arrangements. So what is an HRA? According to the U.S. government, health reimbursement arrangements are employer-funded group health plans or arrangements or employee benefits from which employees are reimbursed tax-free for qualified medical expenses up to a fixed dollar amount per year. And let's break that down a little. So HRAs are 100% employer funded. Employees may not contribute to them. Allowance amounts and rollover rules are set by the employer. The IRS eligible expenses covered are set by the employer. Employees do not have to pay taxes on the amounts they receive from their HRAs, and employees cannot take their HRA to a new job. How did HRAs come to be? We're going to take a quick glance at the history of this important benefit. So in 1974, Congress passed the Employee Retirement Income Security Act, or ERISA, One of the after effects of this landmark legislation was the official creation of Health Reimbursement Arrangements, or HRAs. Part of ERISA's intent was to make sure that employers' arrangements for health benefits were provided fairly to all employees. The creation of HRAs spurred many employers to move to lower cost, higher deductible health insurance plans. So with HRAs, they could provide tax-free reimbursement to employees to help meet the higher employee deductibles that high deductible health plans brought along with lower employer premiums. This arrangement came to be known as an integrated HRA because it is integrated with a group health insurance plan, usually a high deductible health plan. This is the HRA you may already be familiar with, as it remains the most prevalent type of HRA offered today. Many companies set up their HRAs to cover the cost of deductibles for the high deductible health plan that it integrates with. But as healthcare costs continue to rise for both employers and employees, small businesses in particular were finding it hard to afford any form of group coverage, including high deductible health plans. In 2002, the IRS issued a notice that allowed employees to offer HRAs that did not have to be integrated into a group health plan. The standalone HRA was born. An HRA could now be the only health benefit offered by an employer. Many employers chose to use this type of HRA to cover some or all the costs of their employees' individually purchased health insurance premiums. Then in 2010 came the Affordable Care Act, which shook up the entire healthcare industry. Certain ACA provisions had unintended consequences that generally impacted HRAs. Employers were unclear on the rules for reimbursing employees for medical expenses with or without an underlying group plan, and the growth of HRAs stalled. One ACA interpretation was that any company that reimbursed for health insurance, including for individual plans, as many small businesses did with standalone HRAs, was technically a group plan. And group plans had to provide preventative care at no cost or be penalized, which standalone HRAs from small businesses were not able to do. We're getting there. We're in 2013, the IRS ruled that HRAs needed to comply with ACA rules and be integrated with an underlying ACA compliant health plan. This essentially ended, for the time being, the standalone HRA. Whew. So with the ACA's impact, small businesses that couldn't afford group insurance didn't have many options to help employees pay for health care. So in 2016, the 21st Century Cures Act sought to redress this state of affairs, creating the Qualified Small Employer HRA, colloquially referred to as the QSEHRA. This gave some employers a means of providing employees help with individual insurance premiums and other out-of-pocket medical expenses without violating the ACA. We'll look at it more in detail, but essentially the QSEHRA became a new iteration of the standalone HRA, allowing employers with 50 employers or fewer to offer a healthcare reimbursement benefit that didn't require them to take on the expense of group coverage. In 2017, in an executive order, the Trump administration directed the Secretaries of Labor, Treasury, and Health and Human Services to propose regulations that would increase the usability of HRAs, to expand employers' ability to offer HRAs to their employees, and to allow HRAs to be used in conjunction with non-group coverage. The result was a rule issued by the Internal Revenue Service, the Employee Benefit Security Administration, and the Health and Human Services Department in June 2019. The rule creates two new HRAs available from January 2020, the Individual Care HRA and the Accepted Benefits HRA. And we're going to go into all these in greater detail in a moment, but in a nutshell, the ICHRA became another option for standalone HRA, going beyond the QSEHRA, allowing employers to reimburse premiums and certain expenses that employees pay under individually purchased health insurance. Employers don't need to tie it to a group health plan, and unlike the QSEHRA, it's not limited to employers with 50 or fewer employees. Now, with the EBHRA, or the EBHRA, employers who offer group insurance can provide reimbursement for certain accepted benefits, even to employees who decline their group health coverage. Again, we're going to get into details in the moment, but we had to lay that out for you. And we're going to pause for a poll question, which I'm going to let Eddie take because I've been talking way too much.
Well, thank you, Becky. That's good stuff there on the history of HRAs. So let's just go over our first couple of poll questions here. We're going to send these out rapid fire, one after another. So you should be able to, on your screen, in a moment when I change slides, you'll be able to actually answer this as multiple choice, true, false, or maybe. So this is really designed to get a sense of our baseline understanding of some key elements of HRAs. So again, true, false, or maybe. Our first question here is employees can contribute to their HRAs. True is A, B is false, and C is maybe. So we'll give everyone just a couple of seconds here to go ahead and answer this, and then we'll move on, check out the results, and move on to our next question. Looks like we're getting some submissions in, so let's check out the results. And pretty good so far. Almost 92% of you answered false. Employees can contribute to their HRAs. You are correct. As Becky had mentioned, HRAs are employer funded only. Next question here as we move right along. HRA reimbursements are tax-free for employees. A is true, B is false, C is maybe. And again, please participate in as many of these questions as you can. This is required in order to qualify for the continuing education course. And we have, I think, about 5 or 6 of these total in today's presentation. Looks like some of the answers are in. And so far, at least on my screen, it's showing 100% are true. So you're correct on that one. And here's our third one here on this rapid fire. And it is HRA reimbursements are use it or lose it for employees. Again, true, false, or maybe, and we'll wait for a couple of these to come in. Again, you might have to move around your widgets a little bit to view the multiple choice screen, but if you're unable to see that, you can always enter it in the Q&A, but these results will populate automatically on our screen here as these answers come in. Looks like we have the majority of you have answered this question, and we're a little all over here. So we got about 70% at true, 16% at false, and 14% at maybe. So let's move this right along. So back to you, Becky.
Thanks, Eddie. So good job, guys. Way to be on it answering there. What really makes HRAs different, though, from other employee benefits is the extent of employer control over the healthcare costs that HRAs deliver, along with the great flexibility in designing HRA plans. So with HRAs, employers define the amount of funds provided, what's covered, whether employees share costs, and when the HRA is activated. We're going to look at this in more detail when we talk about plan designs a little bit later. But Eddie, can you elaborate on this for us?
Yeah, absolutely. One of the unique aspects to the HRA really is that flexibility and that customization, and there really is no one size fits all. A lot of times we get asked by employers, how should I design my HRA? What should be eligible? How much funding should I offer? And it really varies from one group to another. That's really the beauty of it. So our response to that is kind of, what are your goals? What are your financial goals versus your benefit goals? If you want absolutely the richest plan possible, the richest benefit possible, and you don't really care, what the usage is out of the benefit, you can fund it heavily and open it up to all IRS eligible expenses like medical, dental, and vision. Or if you're just looking to fill a specific gap, like, for example, your emergency room copay increased significantly and you want to keep it the same where it was previously, then you can customize your HRA just to fit that specific need. So lots of flexibility here. Again, the employer defines how much money is available, when it's available, meaning first of the year or each month or quarterly, semi-annually, incrementally over the course of the year. What is covered, again, just medical or just prescriptions, just emergency room, and then also the employee cost share component, which we're going to review in a little bit more detail later on in the presentation.
So how do HRAs work in practice? As we'll see, there are different types of HRAs with different rules, but mostly how they work boils down to these 4 steps. First, the employer makes available the predetermined monthly allowance employees may receive. Now, generally, it's put into an account for each employee and managed by a benefits administrator partner. Second, the employee has a qualified expense, for example, a copay or prescription drugs. Since HRAs are reimbursement arrangements, employees typically must pay for the services first themselves, unless, of course, their HR plan design allows for a debit card to access their funds. Benefit administrators might typically offer multiple ways for employers to purchase qualified health care services, including via debit cards or online portals. Third, the employee submits proof of purchase. Benefits administrators offer various ways to accomplish this as well, including the ability to submit receipts via mobile apps. And finally, the employee is reimbursed by the employer, unless they have already swiped their debit card to pay for the expense. Again, a variety of ways may be set up to accomplish this, including automatically the insurance carrier data, if it's an HRA that's tied to a group insurance carrier. And before we look at the prevalence of HRAs in the market today, let's poll another question. Eddie?
All right, next poll question is, what percentage of your current clients would you estimate currently offer HRA options or offer a plan with an HRA that's integrated with it? So you can answer this as A, 0 to 25%, B, 26 to 50%, C, 51 to 75%, or D, 76 to 100%. So I've just opened up the poll. We'll give everyone 20 or 30 seconds to go ahead here and answer this within the widget so we can display the results on the following page. But I always find this very interesting because really the popularity of HRAs, in my experience, varies significantly by geographic region throughout our country. So for example, in the Northeast, I find that between 50 and 75% of employers are offering HRAs. They are immensely popular. Some employers have had HRAs in place for 15 or 20 years, which is amazing. In other parts of the country, I was recently in the Southeast a couple of months ago meeting with some broker partners, and they said they have one client that has an HRA. So always interesting to see this all over the spectrum. We don't yet have a map of all 50 states that we can display that shows, the results of these answers, but I'm sure that would be an interesting case study. Looks like almost everyone has responded, so let's check out the results. And there you have it. About 65% of you answered that it's 0 to 25% of your clients. And at least on my screen, we're showing not a single response in the 76 to 100%. So always interesting to see. We'll talk about it in a couple of minutes, how HRAs are not yet as popular as FSAs and HSAs. Perhaps they'll never overtake them, but I do think there's a lot of growth happening here with this particular benefit.
Yeah, let's look at some recent statistics now about how HRAs are being utilized today. So HRAs, like Eddie said, not yet as prevalent in the market as are other tax advantage benefits like flexible spending accounts and health savings accounts. According to SHRM, about 16% of employers are currently offering HRA options. Compare that to 63% offering FSAs and 57% offering HSAs. That's right in line with what everybody answered. So you guys are working hard out there right now. However, it is important to realize that HRAs are a rapidly expanding market. In 2010, there were about 10 million HRAs. In 2022, that's grown to 16 million HRAs. I mean, that's a 60% increase. And the more recent options of standalone HRAs, ICHRAs and QSEHRAs, are growing even faster. Since 2020, ICHRAs have grown by nearly 350% and QSEHRAs by 70%, according to the HRA Council. So they're not as popular as HSAs and FSAs, where employees contribute their own money to their accounts. So what is the case for HRAs, which are entirely funded by employers? First, let's look at why HRAs might appeal to employers. So HRAs provide maximum cost control for employers because they are a defined contribution program. Integrated HRAs allow employers to lower their health insurance premiums by virtue of switching to a high deductible health plan from a higher cost plan. HRAs can complement high deductible health plans when employers devote part of the premium savings to help employees offset the higher deductible. And as noted, there is a greater deal of flexibility in plan design, which with options for what's covered, what amount is provided, when reimbursements kick in, etc. And employer contributions are 100% tax deductible and not subject to federal, state, or Social Security taxes. So why are HRAs attractive to employees? Well, employees like HRAs because essentially they're extra money provided to them to pay for health care. And it's money that they don't have to pay taxes on. Employer HRA contributions are typically excluded from an employee's gross income, so they don't increase an employee's tax obligation. Typically, HRAs help employees mitigate the cost of health insurance, whether it's helping them cover the high deductibles through an employer's group plan with an integrated HRA, or paying for premiums through their individual plan with a standalone HRA. We're going to go into more detail on this later. And HRAs can usually be used to pay for care for an employee's dependents as well as for themselves. Also, if the employer chooses, unused HRA funds can roll over from year to year. What do HRAs have to offer brokers? Well, as we noted, they're becoming more and more popular with employers looking to control healthcare costs. So brokers will probably need to have them in their portfolio at least, as their competitors most likely will. HRAs also offer the opportunity to pitch new products, namely ICHRAs and EBHRAs, to potential new clients. And before we drill down into the details of the different HRAs, let's take another poll. Eddie, you'll do this one too, right?
Yep. So let's go into this poll. And just a reminder, if you can, instead of entering your answers into the chat, please try to use the widget here on the screen so that your answers are reflected here in the statistics that we review. So this next question is, what aspect of HRAs do you think will be most appealing to your clients? That is the ability to control costs, the ability to offer a useful benefit to employees, or the ability to customize HRA to a business's preferences and needs. So we'll give everyone just a few seconds to go ahead and answer this question, and then we will examine some of those results. All right, and it looks like we already have a large portion of our responses in, so let's go ahead and check out how everyone responded. So pretty even split here. So at almost 50% here, we have the ability to control costs, followed by the ability to customize HRA to business preferences, and finally the ability to offer a useful benefit to employees. So interesting to see a little bit spread out on our responses there. And again, thank you for your participation on these poll questions.
Now, despite the complexity of HRA acronyms and different plan types, which we will dive into, it's important to remember that the crux of things, there are just two basic types of HRAs: integrated HRAs and standalone HRAs. First, let's look at the integrated HRA. This is the most prevalent HRA in the market. And for brokers, it'll be the most lucrative HRA, because what an integrated HRA is integrated with, of course, is a group health plan, which obviously leads to commissions for brokers. As we suggested when we looked into the history of HRAs, the integrated HRA typically goes hand in hand with an employer switching to a high deductible health plan from a traditional group plan. With that switch, the employer's premiums typically go way down, right? But the employee's deductibles typically go way up. So to soften that blow, employers can take some of the money that they're saving on premiums and devote it to giving employees benefit of the HRA. Often the amount devoted to HRAs will cover all or a significant percentage of the higher deductible. We're going to go deeper into all other plan design options for integrated HRAs later, but now let's look at the other main type of HRA, standalone HRAs. But some employers, particularly small employers, still can't afford to offer a group plan, even if it's a high deductible health plan, but they do want to offer some sort of medical expense benefit. So if you'll recall the history section again, the government made QSEHRA as an option for businesses with fewer than 50 people. And then under the Trump administration, two new standalone HRAs, the ICHRA and EBHRA, were introduced in 2020. The EBHRA is something of a special case as group coverage is involved, but we're going to get into that in a minute. Sounds like we're going to get into a whole lot of things. Y'all hold on. So let's take a closer look at qualified small employer HRAs, or QSEHRAs. This type of HRA is only for small businesses with 50 or fewer employees. To offer a QSEHRA, the small business must not offer group insurance to its employees. Thus, employees are responsible for getting themselves covered by an ACA compliant health plan, possibly on the individual market or through their spouse's employer's group coverage plan. But unlike integrated HRAs, there is a government set annual limit on reimbursements an employer can pay. For 2023, that limit is $5,850 for individuals and $11,800 for families. Then, as of 2020, a new type of standalone HRA was introduced, the Individual Coverage HRA, or ICHRA. Unlike the QSEHRA, which is only available to small businesses, any size business can now offer the new ICHRA. There are no government set minimum contribution requirements and no maximums for allowances. One thing that really distinguishes ICHRAs is the employer can offer a group health plan to some classes of employees and an ICHRA to others. Now, this slide shows some of the ways that employees can be classed, such as full-time or part-time. So, for example, an employer could offer full-time employees a group medical plan and part-time employees an ICHRA. However, employers may not offer employees in the same class a choice between group health insurance and an ICHRA. Okay, and an ICHRA must be offered in the same terms to all employees within a class, with some exceptions, which Eddie will discuss. So there's a great deal of flexibility for ICHRAs. Eddie, so elaborate on some of these exceptions within the class.
Yeah, so there are certain areas that you can basically fund different amounts for different employees. For example, you can do it by age. So premiums on the individual marketplace might be more expensive for a 60-year-old than they are for a 25-year-old. So you can offer additional funding for older employees than you would for younger employees. Similar to, a lot of benefits and HRAs included, you can vary the funding on family size. So family gets 1,000, employee plus children gets 750, employee plus spouse gets 500, and single gets 250 a month, for example. That is allowable. And then you can also differ the funding amounts based on geographic location. So premiums for an individual plan in, say, New York might be more expensive than an individual marketplace plan in Oklahoma. So you could fund higher amounts based on geographic region, as long as it kind of aligns with generally, where those premiums would line up. In addition to that, there's other flexibility when it comes to geographic region, and kind of what Becky said, where ICHRA can be very useful, is that you can't offer both the group plan and the ICHRA to the same class of employees and let them choose. You need to make the decision for them as an employer. So for example, if you do have, let's say, 20 employees in California and you have one employee in Minnesota, but you don't want to necessarily offer that nationwide medical plan because it's more costly to have a bigger national network, you could offer the employees in California the group medical plan, and then the employees in Minnesota or any other state for that matter, an ICHRA. So lots of flexibility there, lots of different ways to kind of spin the ICHRA. And traditionally, I think ICHRAs are targeted towards smaller employers who aren't necessarily ready or can't afford to offer a group medical plan to their employees. But we do see some scenarios where even larger employers can take advantage of an ICHRA, and it might make sense for them. I know we've set up one for a staffing agency that had over 500 employees, and they just had so much turnover that the ICHRA kind of made more sense than a group plan when it comes to, budgeting and employees taking advantage of the program. So a couple of different ways that you can spin this, but I think understanding these different classifications and how you can offer certain amounts for salaried versus hourly, or group plan for salary, ICHRA for hourly. There's a lot of different ways you can slice it.
Thanks, Eddie. So in 2020, a second new type of HRA was introduced, the Accepted Benefit HRA. It's not growing as quickly as the ICHRA, but you should still be aware of it. We're classifying it with standalone HRAs, but you'll see there's a wrinkle in this. Basically, EBHRAs allow employers of all sizes to reimburse employees tax-free for certain medical expenses not covered or accepted by their insurance plan. Such expenses include copays, deductibles, vision dental insurance, COBRA premiums, short-term limited duration insurance, long-term care, nursing home care, and home health care. So here's that wrinkle. EBHRAs must be offered in conjunction with a traditional group medical plan. While we're including it with standalone plans then, well, because uniquely for this type of HRAs, participants do not have to be enrolled in the group plan to use it. They just have to be offered the group plan. So EBHRA may or may not be integrated with the group plan, making it a little hard to classify. So EBHRAs cannot be used for individual or group plan premiums. And as of 2023, the maximum annual contribution cannot exceed $1,950. So it's understandable why brokers are not as enthused by standalone HRAs as they are for integrated HRAs, because standalone HRAs are not tied to group health plans. They're also not tied to the commissions group health plans pay an employer's broker record. And that being said, ICHRAs and QSEHRAs are gaining in popularity. If you're competing for smaller employers who feel they just can't offer a group health plan option just because of the cost, you need to be aware of these options, because of course your competitors will be. Eddie, any comments about this one?
Yeah, I've seen brokers successfully leverage the ICHRA in a couple of different capacities. One of them was that example I gave a minute ago with the staffing agency, but I've also seen brokers kind of bring this suggestion in for, let's say, a small startup company that only has 2, 3, 4 employees. And again, the group plan doesn't make sense at that point. But there's tremendous growth within, a lot of startups. And in 1 year, 2 year, 3 years, 5 years, that startup company might be at 50 employees, 70 employees, 100 employees. Sure, not all startups are that successful and have that much growth, but you're planting a seed early, you've come to them with a creative solution, and after that, you might be the broker of record or agent of record on a pretty healthy sized opportunity. So just another tool for your toolkit. I've also seen examples of organizations that, let's say, I think there was a hospital that had several hundred employees, and they had 3 employees with big terminal illnesses that were just driving up the utilization and killing the renewal for them. So they were able to leverage an ICHRA, still give folks funding to be able to go to the marketplace, purchase those individual plans. And then also, again, back to the part-time. I think there's opportunity there where you're offering the full-time employees the group plan, but the part-time employees still feel like they need some sort of benefit towards health insurance. And so if you're able to offer them even just $100 or $200 a month, that's non-taxable to be able to pay for those premiums, I think it can definitely be a win. So just another nice tool for the toolkit.
Okay, now let's get back to the more common integrated HRAs. One of their key features, as we've noted, is how much flexibility and control they can offer employers in their design. This is an area where informed advisors can help them create a plan that's tailored to their unique needs and preferences. HRA plans can be customized in ways including the amount employees are reimbursed, what employee expenses are reimbursed, whether or not employees share some of the costs, and at what point HRA reimbursements kick in. So, Eddie, talk to us a lot about the aspects of plan design.
Yeah, so this is, again, we touched on this briefly earlier, but we'll talk about it again. This is where really the beauty of HRAs is that it's not a one-size-fits-all. It's not cookie cutter. Each employer can craft this towards their needs to fit their benefit goals, their financial goals, so they can determine how much funding is available. Sometimes you see an employer who just wants to offer an extra added benefit on a non-taxable basis, and they say, here's $500 for medical, dental, vision, and over-the-counter items. Use it however you need and however you see fit. Others will have very specific needs for it. This is just to cover mental health visits that are not covered by the insurance carrier, for example. So you can get very specific with it. There's really no maximum on HRA funding amounts. So if you wanted to, fund $10,000 or $15,000, obviously that's extremely generous. But if you're an organization or your client is an organization that's just looking to have the absolute best benefits out there, regardless of what the underlying medical plan is, whether it's a gold plan or a bronze plan, traditional plan versus high deductible, if you want to have the most attractive benefits package so that you can attract and retain really talented employees, this could be a solution for you. And then again, what expenses are reimbursed? Again, you can keep it very high level. What is eligible under an HRA can be the same list of eligible expenses as FSA and HSA, and that's IRS code 213D. That includes medical, dental, vision, orthodontia, over-the-counter items. So a very generous, open-ended HRA could cover all of those items, or you could get very specific, down to the point where you can say, we're giving you a debit card that swipes $10 per prescription, and that's it, and you're responsible for the remainder. So really that ability to get very creative with your plan design and determine what type of eligible expenses are reimbursed. Obviously, the more expenses you open it up to, the higher your utilization is going to be. So if cost control and utilization is a major concern, then maybe don't open it up to all IRS 213D, because then even your healthiest employees might be able to find something to be able to use those funds for, like sunscreen or a new pair of glasses or some dental work, things like that. And that will naturally drive up your utilization. And then you have the employee cost share. So the most generous HRA, of course, might cover 100% of the deductible or 100% of the maximum out of pocket. But as we're going to see in a couple of minutes, you have some flexibility there. Does the employee have some responsibility up front before the HRA kicks in? Does the employee have some responsibility on the back end after the HRA funds are depleted? Do you have a donut hole? Or do you have a percentage share per claim? Like the HRA covers 75% per claim, and the employee's on the hook for the other 25%. Those are all the different aspects that an employer can kind of craft their HRA to fit their needs.
Before we delve into plan design further, then let's take another poll question.
Yeah, so next poll question is, which way of customizing an HRA plan do you anticipate that your clients would be the most interested in? And that is limiting what eligible expenses are covered, the employee/HRA cost share responsibility, offering reimbursement for all eligible expenses immediately versus incrementally over the course of the year, and increasing utilization with easy-to-use, convenient tools such as debit cards. So looks like we already have some of these answers coming in, and we'll just give everyone about 10 more seconds to go ahead and answer, and then we'll check out some of these results.
I'm loving, Eddie, how, I mean, just watching these options, which is going to be the best, they all are so great. Like, I love the flexibility of these HRA plans, and I know you have to pick the right one to get the right flexibility, but you really start understanding all of these, and we're going to talk a little bit more. The next section is my favorite, so we're going to talk a little bit more about it, but it's going to be amazing for some of these employees.
And another nice aspect to that, Becky, is that employers can tweak their HRA plan year after year. So if you find out your utilization was a little high year one, you need to bring it down to fit your budget, you make some adjustments. If you find people aren't using the benefit at all, then maybe you need to open it up to more expenses or provide a debit card, plan design allowing. Things like that allow you to make adjustments as needed. So the results here are leading the way. 40% is the employee/HRA cost share responsibility. Love that answer. We're going to dive into that in just a couple of slides here so that the employee has some skin in the game and has some responsibility. Again, we want to encourage consumerism. Number 2 is limiting what eligible expenses are covered, and then followed by offering reimbursement for all expenses immediately. And finally, increasing utilization with tools such as debit cards. Again, that really depends on if the employer wants that utilization to be there versus if they're more in a cost control model.
So let's talk about what expenses can HRA cover. There are nearly 300 listed in IRS Publication 502, which defines medical and dental expenses eligible for HRA reimbursement. This list includes deductibles, coinsurance, physical therapy, prescription medications, over-the-counter medications, and insulin. When designing their company's HRA, employers have the ability to set which of these eligible expenses their company will reimburse. So how are employers determining which expenses an HRA will cover? A common design is an HRA that reimburses all uninsured medical expenses. In other words, employees can use them for any of the IRS Publication 502 eligible expenses that don't get paid for by their group insurance and that they need to pay for out of pocket. Another option is an HRA designed to pay only expenses directly related to the group medical plan coverage, i.e. deductibles, coinsurance, and copays. Or there's a limited purpose HRA designed to reimburse employees only for out-of-pocket dental and vision expenses. Additionally, there is what is termed a select services HRA. These are used when employers wish to provide expanded coverage for a list of select services that are not covered by a health plan, possibly due to environmental, social, or regulatory factors. For example, a select services HRA might be designed to cover fertility benefits or birth control services. So these are all options for designing an HRA plan based on what expenses are reimbursed. Eddie, any other examples of this, how this benefit works and why it's such a great one?
Yeah, I think the example you just mentioned there, Becky, fertility benefits is a great example. I was working with a broker who was trying to pull a group out of a PEO, and due to their group size, they couldn't find a medical plan that would cover IVF and freezing of eggs and fertility benefits. So they were actually able to leverage an HRA, give it a lifetime benefit of like $20,000. You can access it as long as you remain employed, and basically was used to cover those expenses. So they were basically able to fill a gap in the benefits and win business because of it by leveraging an HRA. And $20,000 is a lot of money, and for that to be non-taxable, but if the money's utilized, it's tax deductible to the employer, that was a huge win. Another one is kind of goes in line with the example I gave earlier. We were working with a group that had basically a union, and they had a collective bargaining agreement that said you get unlimited mental health visits, but the underlying medical plan had a cap on that, or at least they were only covering X amount of in-network mental health visits. So they were able to leverage an HRA, do it on a tax advantage basis to cover an unlimited amount of mental health visits that are not covered by the insurance carriers. So again, I think what we're trying to explain here or convey here is that, you know, traditionally we thought HRAs have to be integrated with a high deductible health plan. That's not the case necessarily. There's a lot of different ways to leverage HRAs, and we'll talk about a few more in just a minute. But you know, I've even seen examples where the HRA, if the deductible increased from $1,000 to $3,000, and it's just major medical expenses like inpatient and outpatient that are applying to that deductible, they crafted the HRA just to cover that gap. So after the employees satisfied their $1,000, the HRA kicks in, covers the next $2,000. It keeps the employee's exposure the exact same as it was on the prior plan, but perhaps the employer got a little bit of a reduction in premium because that deductible went up. So again, not just limited to high deductible health plans. That's really where HRAs gained their popularity, but now there's just a lot of different ways to leverage this benefit.
So another way some employers may want to design a plan is based on employees sharing some of the cost. This motivates employers to make more informed consumer choices about their healthcare expenses. Well, it's the employees that'll make those choices. So since they've got some skin in the game, as you mentioned earlier, Eddie, how are employers implementing this? Well, with an HRA deductible design, employees are required to pay out of pocket a certain amount or deductible before the benefit kicks in. With the HRA coinsurance design, the employer reimburses a portion of the of all eligible medical expenses. For example, the employer might pay 80% of the cost of a prescription medication, while the employee pays 20%. Another approach is the HRA split copay design. So let's say an employer has switched to a less rich traditional group plan, and the copays for office visits are going to increase for employees. To mitigate the impact of this, an employer could design a plan that reimburses employees for a part of the higher copay, say $20. So it's effectively become closer or the same as what employees are accustomed to paying. Let's take a closer look at how split copay design might work. Now, this chart shows the various services, the total copay for cost for each, and how the HRA and the employee might split the costs. For example, with that $50 primary care copay, the HRA might cover $20 and the employee would pay $30. Or an emergency room visit might have risen to a $500 copay under a new health plan. And the HRA might pay $20 and the employee the HRA might pay $250 now and the employee pay $250, which may be closer to what they were accustomed to in a previous health plan. So Eddie, do you have any experience with these type of creative plan designs?
Yeah, I do have a lot of experience with this type of plan design, and not every administrator has the capability or is willing to administer a plan of this type. But I think the concept is sound in that your health plan is changing for whatever reason. You got hit with a 25% increase. You need to make some adjustments to it. Go to a less rich plan. Employees are not ready to go to a high deductible health plan. Maybe the premium reduction isn't there, or maybe it's just too much of a learning curve. So you want to keep a plan with copays, but now the copays have gone up significantly, and that might, employees might feel that pinch. So you can get really creative, like Becky said, give them a debit card used to split the difference there in that increase. The employee out-of-pocket exposure stays the same. But you've reduced your premiums or kept them close to where they were by going to this type of underlying plan. And the beauty of this is what you can do on the debit card, especially if you have HRA and FSA, is you can swipe with many carriers, not all, with many HRA administrators. You can swipe the card for the $50. It would automatically pull the $20 from the HRA, and the remaining $30, the employee responsibility, from the FSA, their own pre-tax funds, all in one swipe. So that gives you a really good user experience. The employees having a good experience. They're leveraging their pre-tax FSA dollars, and the card is doing all of the split for them. So really a lot of different ways you can get creative. And again, you can set up multiple buckets. And that's what this design here is showing, is that you're reimbursing $20 for primary and specialist, $250 for emergency room, and then you're covering $3,000 out of the total $5,000 towards the deductible. And then while all that's happening, your prescription drugs are being paid at 50% per swipe, whether it's one prescription or multiple prescription, whether it's a tier 1 drug, a tier 2, or a tier 3. So this isn't necessarily the solution for every group, and I think it's very important to understand that in most cases, keeping it simple is better for the participant. However, that's where I think your HRA partners come in and can kind of guide you and say, look, this is a good idea. This will be user-friendly. We need to do a lot of education, but we're overcomplicating it if you do A, B, and C, and employees might have a challenge with that process. So again, keeping it simple, but also leveraging technology like a debit card to really achieve your financial goals and keep employees' benefits right where you want them to be.
Yeah, I love that. There's that flexibility and control, right, that the employer now has. I love that. So the last plan design approach that we'll look at centers around when the HRA is activated. The most straightforward approach is employer pay first. So in this approach, HRA reimbursement funds are available immediately, and the employees can access them until they run out. Then you can have an employee pay first model, which is essentially the same as the HRA deductible approach we talked about earlier in the cost sharing modes. The employee pays a specified amount before the HRA kicks in. Now, another variation is the donut hole model. Eddie, explain the donut hole model and the percentage share concept that we see here.
Yeah, so the donut hole model is kind of a hybrid of those first two that you talked about, Becky. It's basically layering multiple HRA buckets with an employee responsibility in the middle. And it could be the opposite of that. You could have the HRA funding in the middle. But in this example you see here on the screen, the first $2,000 would be made available to the employee up front to cover the first $2,000 of their $5,000 deductible. Once they've satisfied that, they are on the hook for the next $2,000. If that gets satisfied, the HRA kicks in again and covers the last $1,000 of the deductible. So again, what this does is employee has some skin in the game, encourages some consumerism, but still offering a good level of benefit, and also realizing that really the vast majority of your employees are not going to have to touch that last or that second bucket of HRA funding, which keeps your HRA utilization in control. So percentage share is kind of a similar concept of encouraging consumerism, and you can pick any percentage share. As far as the debit card capability, the card can really only do percentage splits at the pharmacy at the time of service. Everything else would be manual claim submission or leveraging a claims feed from a carrier. But that basically you can say, I want to cover 70% of every claim up to X amount, and the employee is responsible for the other 30%. I like this concept because, again, employees aren't just going to go out and go to the doctor or the specialist for every little thing. Maybe they're more inclined to shop around if it's something like an MRI, or they're going to ask for a generic equivalent to a prescription, again, because they have some responsibility there. So a lot of different creative ways to slice this.
And I think you're about to get a little more creative because you're going to show us how else we can mitigate, how else the employee can mitigate some of those fees. Again, there are a number of ways to design an HRA plan to address just how the employer wants an HRA to be used by their employees. But now let's move on to how HRAs interact with other popular employee benefits, namely HSAs, FSAs, and COBRA. Eddie, walk us through these slides. I know we've been talking a lot. We're running short on time. Can you walk us through how this all stacks together?
Yeah, so we got 10 minutes left. Let's wrap up how HRAs interact with these other benefits. So we get asked all the time, so can an employer offer both an HRA and an HSA or a health savings account? And the answer is yes, but they do need to deploy what we call at Clarity HRA HSA stacking, basically the ability to leverage both of these benefits together. And this does have to be integrated with a high deductible health plan. So the IRS rules state that when an individual or an employer is making contributions to an HSA, that they cannot also receive HRA funding until they've satisfied the HSA minimum deductible requirement. For next year, 2024, that minimum HSA deductible requirement is $1,600 for an individual, or double that, $3,200 for family. And this basically means that an employee enrolled as a single has to satisfy that first $1,600 towards their medical deductible before they can use any HRA funds to pay for medical expenses. So that $1,600 can be paid out of the HSA. I think that's pretty common. Or if they can afford it, you can pay it out of your own pocket, and that allows you to save or invest your HSA funds for use down the road. So once the minimum deductible, again, of $1,600 or $3,200 has been satisfied, then the employee can begin to access the HRA funds, assuming the employer has structured it this way, to be used, and again, use the employer-provided funds for those medical expenses for the remainder of their deductible, or at least the next portion of their deductible. So in summary, if an employer wants the employees to be able to contribute to their HSA, but they also maybe want to bring down that really high deductible so that employees can save and invest some of their HSA money, they can provide HRA funding, but they should structure their HRA so that the employee is responsible for at least that first $1,600 before the HRA funds become available. So essentially it falls under that employee pay first HRA plan design that Becky reviewed a couple of minutes ago. Again, this just allows the employees the ability to fund their HSA up to the annual maximum, but also really brings down their overall deductible exposure, their out-of-pocket exposure, by layering an HRA on the back end. So again, it can occur right at $1,600, or if you have a $5,000 deductible and you want the HRA just to cover the back $1,000, to therefore kind of make that a $4,000 deductible, you could certainly do that as well. I like this concept, but again, it also takes an educated employee or consumer to understand how to leverage both of these benefits, and that's where your partner can come in and provide some education. HRAs and FSAs, yes, you can definitely have both an HRA and an FSA together. The FSA would pay for any IRS 213D expenses that are not already reimbursable under the HRA. If the same expense is eligible to be reimbursed through both plans, the cost would be reimbursed by the plan that the employer has set up to pay first. So we basically program using priorities because it's important. You can't double dip, right? You can't have a claim for a prescription and submit for reimbursement through both your HRA and your FSA. So if if prescriptions are eligible for the HRA, that's the account that it's going to pull from when the debit card is swiped. And then when those HRA funds are depleted, then it would automatically pull from the FSA. And the card is usually even smart enough where you swipe it for a medical expense, let's say, it could pull from the HRA. Later that day, I swipe it for a new pair of glasses or at the dentist, it bypasses the HRA and pulls funds from the FSA. So again, able to get creative, but also leverage technology so that the employee doesn't have to think, it's just easy. And finally, HRA with COBRA. An HRA is a COBRA eligible benefit. You must offer an HRA as part of COBRA for qualified beneficiaries if they have a termination or a qualifying event. However, the employee has to pay additional COBRA premium in order to access those HRA funds. So how is that premium determined? You can see it here on your screen. There's really your year one model, and then any years after that when you have utilization to determine it. So basically, this slide shows an example of what sort of monthly premiums would be required for $1,000 versus HRA funding. In year one, when you don't have any prior plan year utilization, you use 75% as your number and you follow this calculation. I want to point out that the multiplying it by 1.02, that 0.02 factors in the 2% that an employer or a COBRA administrator is allowed to charge for COBRA administration. And basically you follow this calculation, and in subsequent years, when you do have HRA utilization data, instead of using 75%, you'd use whatever that utilization was across your employee base. So if all of your utilization across your HRA was 40% from last year or the years prior, you would use 40% instead of 75%. And again, this is premium that the former employee pays in addition to their underlying medical plan premium in order to give them access to HRA funds after they've terminated.
So we got all of this in our toolkit. Now we have to understand how in the world we're going to make all of this happen. So we've established that they can be somewhat complicated. And when employers work with a good benefits administrator partner, they can really cut through some of the complexity and come up with a plan that gives them more control over their healthcare expenses. What should employers look for in an HRA partner? Well, first of all, of course, expertise in HRAs, including the areas of compliance, and they should have the ability to help them calculate how much money can be saved in healthcare costs by leveraging different HRA plan designs. Should be able to know really exactly how to plan that. Partners who offer a range of HRA products and have the ability to customize them with creative plan designs, extremely valuable. As our partners who have up-to-date technology platforms that easily integrate with an employer's HR system and lets them easily monitor and analyze their HRA program's effectiveness. Finally, employers need a benefits partner that supplies excellent service, including tools that make it easy for employees to track and process claims and that facilitate enrollment and education. A little bit of a learning curve here. And before we wrap up, let's ask the last poll question, Eddie, and then we'll hit one of the chats.
All right, last poll question here is, what would your clients most value in a benefits partner for HRAs? A is the technology platform. B is the ability to communicate the HRA benefits and educate employees. C is the range of HRA offerings and the capabilities. And D is the responsiveness of customer service. So we'll give everyone just 5 or 10 seconds and we'll check out these results, and we can go ahead and answer any questions that we got in the chat and wrap up right here at the top of the hour. All right, looks like we already have quite a few responses in, so let's check them out. And range of HRA offerings, not surprised to see that. I think traditionally we think of HRAs in a very vanilla, structured, one-size-fits-all, cookie-cutter solution. Hopefully with what we covered with you today, it opened up your mind to some of the other solutions that are out there. Again, capabilities vary from one administrator to another, but I think there's a lot of creative solutions around HRAs, and clearly you felt the same. So thanks again for your participation. That's great.
Okay, so that's an overview of HRAs and how they can be customized to meet employers' needs, give them a greater control of their healthcare expenses. We do have a minute for questions. So Eddie, I know you're looking in the chat right now. Just pull out one or two just so we can get everybody to the end of the line and get them over that 1 hour mark. While he's doing that, thank you all so much for coming. We appreciate you being here. And of course, you can reach out to Eddie or myself if you have any additional questions.
Great. So I'll try to answer a couple of these as quickly as I can. I promise if we don't get to your question, we will follow up with the answer to that. First question, can an employee going on COBRA just select the health insurance, or are they required to pay for the HRA COBRA as well as the health plan premium? That is a great question. Actually, the employer can decide to offer the medical plan plus the HRA as a bundled package, meaning you get one or neither, all or neither. or they can offer them unbundled, basically giving the employee the option of taking just the underlying medical plan or then taking the plan and buying up to the HRA. I personally like the unbundled approach because I wouldn't want a former employee utilizing my HRA and driving up that utilization. But again, that's up to the employer. How does an HRA compare to a MERP? This is a great question. All HRAs are MERPs, but not all MERPs are HRAs. To get into that, I would suggest you reach out to your local Clarity rep as a resource because we could talk about that for a while. But MERPs are very wide, open-ended benefit, I think you could say, that allows for some employee contributions to it, where, as we mentioned, HRAs do not allow for employee contributions. So that's a longer discussion, but I see a ton of amazing questions in here. I wish I could offer all of them, answer all of them, but we are going to provide you with a white paper. It's available here in the resources section. So that'll help you communicate on HRAs. And again, we're going to reach out to each of you personally to answer these questions because I just see a ton of great questions. So want to be respectful of everyone's time. It's 1 o'clock East Coast. So thank you so much for joining our continuing education course today. I hope it was beneficial to you all. And thank you, Becky, as always, for being our host here.
Thanks, Eddie. Great job today. We'll see you guys soon, okay?